You know exactly what you need to do. You can see it clearly. You want to do it and you can't move. That's not laziness. That is not lack of discipline. That is a neurological access problem. And there's a significant difference between those two things. In this video, I describe ADHD paralysis from the inside and as someone who lives it, and then explains the neuroscience behind why it's happening. Why just do it is the worst possible advice for our neurodivergent brain and what actually creates movement. Okay? Before we start today, quick but important reminder, I am a physician, but I'm not your physician. Everything I share on this channel is for educational purposes only and is not a substitute for personalized medical advice, diagnosis, or treatment. Please always work with a qualified healthcare provider who knows your full medical history before making any changes to your health plan. If you're in crisis or you need immediate support, please reach out to a medical professional or crisis line immediately. I'm Dr. Sarah. Welcome to Coffee with Me. I'm the owner and founder of Lush Lifestyle. I specialize in neurodivergent women's health, hormones, brain health, longevity, and I'm neurodivergent. Today's video is one of the most personal ones I've made because I'm not going to describe, because what I'm going to talk about today is something that I've lived, not past tense, present tense. Okay, we're going to talk about ADHD paralysis, the state of knowing exactly what needs to happen and being completely unable to make it happen. Raise your hand if you were in the room with me. Okay, I want to describe this from the inside first because I think clinical language doesn't capture how truly strange and distressing this experience is. And then I want to explain why it happens. Because when you understand the mechanism, like we've talked about before, you stop blaming yourself and we can actually do something about it. At the least, understand what's happening, right? Let me describe a specific experience. There is a task. It is an important one. You know, that important, okay? You've thought about it many times. You may have even written it on a list, maybe 10 times. Set a reminder, told yourself today is the day. You sit down to do it, and then flatline, nothing. Not a decision not to do it, not distraction, right? Exactly. Something more like a wall between you and that action. You're present, you care, you think you can do the task, you can think about the fact that you need to do the task, you can feel the discomfort of not doing this important task, but the movement, the actual initiation is just not accessible. Again, anybody, has this happened to anybody? You might open the document and close it again. You may switch to something else and be like, I'll come back in 5 minutes, right? You may go to a different room. You may drink your coffee. Check your phone. Hours pass, and guess what happens? We still don't do it. Okay. This is ADHD paralysis, right? And it's not relaxing. It's not fun. It causes, a significant amount of distress. And we got to talk about it, right? Why is this happening? Here's what's actually going on. So ADHD is fundamentally a condition of dopamine dysregulation. We know that. Specifically in the brain circuits that govern what? Prefrontal cortex, right? Motivation, initiation, executive functioning. So in a neurotypical brain, that prefrontal cortex that is responsible for all these things has reliable access to dopamine, means it can generate the motivational signals needed to start a task, even when the task is not inherently interesting or rewarding. While in our neurodivergent brains, that access is inconsistent. That prefrontal cortex cannot reliably generate that start signal, right? It needs external help. And that help comes primarily from two sources, interest and urgency, right? Interest is when a task is generally engaging, novel, or personally meaningful. The neurodivergent brain can access enough dopamine to initiate it. And then urgency. So when you have a deadline, when something is imminent, when the stakes are high, when the consequences of not acting are immediate, that stress response provides a neurochemical shortcut that can bypass the dopamine deficit and create movement. This is why neurodivergent brains often function well in crisis, right? We're great in crisis. Boom, 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 everything's working. But it's a normal day life and it can feel like a failure, right? The cruel irony of this paralysis is that the tasks that trigger it most severely are often the most important ones. The ones that have high stakes enough to generate anxiety, but not urgent enough to have us tap into that dopamine space, right? I call that the neurological trap. Okay. And so for women, with neurodivergence, this is not consistent throughout the month. Just like we talk about the biology of the neurodivergent brain, throughout our cycle, estrogen, progesterone are changing, right? Testosterone peaks at different times. Estrogen, we know, supports dopamine availability. Follicular phase, we get that follicular lift, right? Estrogen rises, all is good. We're completing all the tasks. We're coming up with all the projects. We can initiate whatever we want. Then 2 weeks later, luteal phase. It's estrogen drops, dopamine goes down with it. And man, this is really a problem, right? We can't do anything, all right? And so that's why a lot of neurodivergent women will report that their paralysis clusters are worse the 2 weeks before their period, week to 2 weeks, right? This makes sense, right? This makes complete sense. Um, so what actually helps? What helps? I want to be clear, and I am not going to give you a productivity system, right? We don't need another planner. And to be honest with you, those things are designed for neurotypical brains, and they almost always fail us. Almost always, which is probably the reason why you have probably 67 planners, right? I don't know, raise your hand, I do. When I tell you what I'm going to talk to you about is the framework that I actually use. Work with interest, not discipline. When you need to initiate a hard task, your first question is not how do I force myself? It's how do I make this more interesting? Okay, body doubling, right? Working alongside someone else, even virtually. Novelty. Go to a new location. Maybe it's a new playlist you're going to listen to, a timer that creates artificial urgency, right? Reducing the size of the first step until it's almost laughably small. I'm going to open the page and write my name, right? Work within your cycle. Identify your high dopamine phases and put your hardest tasks there. Give yourself explicit permission to do less in your luteal and plan for it rather than being surprised by it every month. Address the underlying neurobiology, right? Medication if it's appropriate. Supplements, mitochondrial health. What is your happening at a cellular level? What does your ferritin look like? What is your vitamin D? Are you taking magnesium? Right? Do I need hormones? Am I in midlife? They're not shortcuts. These are neurological support for your brain, a brain that works differently. Okay. And that's great. Our brains are amazing. Our neurodivergent brains are the reason why we have succeeded and done the things that we have done. But we have to support them differently. Okay. Stop telling yourself you're lazy. Stop telling yourself your brain requires something different. No, it needs a different solution. Okay. It needs a different solution. So you need to figure out what that solution is. How do I help my brain be as most productive as possible? And that what works for me isn't going to work for you, right? So we got to work on that together. Okay? Together, you heard me, together as a team, as a community. So if this video gives you language for something that you've been living with, share it with someone, please. We need a bigger tribe. All right, come on over to the Substack. Mondays and Wednesdays, you have new releases there. I would love to have you as part of our tribe over there. Drink your coffee, and as always, until next time, stay well.